There is growing evidence that COVID spreads through air, but it's been hotly debated.
Whenever somebody raised the precautionary approach, they said, no, the evidence is not there.
We dive into the science and the response next. Welcome back. The pandemic has dragged on for so long, it's a bit hard to remember how new the coronavirus really is. Even how it spreads has been a matter of scientific debate. But for some time, the growing consensus has been that it is fully airborne. Policy is still catching up to that science. And Joanna Remiliotis spoke with some who think the delay has put lives at risk.
By now, we know the drill. Wear a mask, stay apart. But a bigger risk and reality was always there, even if the warnings weren't, that COVID is in the air.
And it's a tragedy that our infectious disease experts were following old science.
That meant taking precautions against aerosols, tiny particles expelled when a person is simply talking that can travel in a cloud indoors and remain in the air indefinitely. David Fissman is an epidemiologist and infectious disease expert with the University of Toronto's Dalla Lana School of Public Health. But as Fissman studied early outbreaks on cruise ships, something didn't add up.
People being confined to their cabins were getting infected, even though they weren't in contact with anyone else who was known to be infected. So they were connected to each other by a ventilation system. That should have told us it was aerosol. And then what's emerged over the subsequent, nearly a year, has only sort of supported that model.
The warnings got louder. In July 2020, an open letter by 239 scientists, a global appeal to recognize the risk of airborne transmission. That same month, the World Health Organization did.
The grocery stores and seeing staff protected with plexiglass and surgical masks when this is an airborne disease. Reading about workers at Amazon warehouses and factories and meatpacking plants who are not being properly protected.
What do you think would have changed?
Well, we would have increased emphasis on ventilation, air purification in our long-term care facilities, in our warehouses and meatpacking plants, and in our hospitals.
Posamai is calling for a national inquiry.
We're going to have other major public health crises, and we have to be ready for it. And we can't make these same mistakes another time.
And there will be a next time. Joanna Remiliotis, CBC News, Toronto.